earlier is Edward Wabule. I'm a clinic officer, the facility in charge. And the first thing I'd like to say is that to appreciate the Ampath fraternity, because actually they have did a lot compared us to how the situation was previously. First, I'm only also like 2 years in this facility, and I have worked with another 2 programs, the previous one and the current one, which is the Ampath. And I have noted there was a difference in how they manage things. First, the previous one, the only thing they were interested on my side, how I view was the report. And my Q report can be played up around to please the one who is receiving the report. So they were not interested in the patient care per se. The Ampath, okay, they are very close. They are close to their staffs. That is what I have come to realize. Every time, like in a month, they have to come around, see how their staffs are working with the entire hospital, and go to the files. If there is a problem with a patient, a particular patient, on most of cases, I have found them calling the patient back. We review the patient with the staffs, the Ampath heads at the facility, which it was a dream in the previous. That is, I just appreciate for that. For doing so, now their patient gain the confidence that also our life matters. If the bosses can come around and tell us what was actually needed for us, then from that, this patient has the defaulters themselves. I have seen the defaulters themselves coming back without any intervention, because they see now those who are being served, they have no complaint. Why should I stay at home? That's why one reason why we have seen the numbers rising and defaulters coming down. Another thing I really want to appreciate Ampath is the support for the staffs. Okay, when I came, the CCC had a nurse. He crossed over to other employer, that is the county employer. Then from there, the blank space was left that way. Now that was like around for more than a year without a clinician. And some of our staffs for the counties also were transferred, others resigned to work to other counties. So we had a gap in staffing. But little was done. That is where the problem now started. A lot of defaulters started increasing. Patient management also was not to the par that is required. I tried, because I previously worked in a CCC, so I took the responsibility to make sure that the patient, because all of them are patients in the facility, they have to be served. But now, with the minimal human resource, I was not able to actually deliver what is required of the patient. And minimal was done to regard that. But I done for the Ampath, when they do go over, you came here, then we discuss what the needs of the facility. Then we said our part that we are understaffed, and you really saw that we are actually understaffed. Actually, the program lead himself, he gave me his card now. I can attest to you that was the first business card number I had ever seen. Yeah, it also then it encouraged me also that he cares even for the lawyers. That is now how he motivated me also to continue working with the CC. I had reached a place and said, hey, now this is too much. I'm the only CEO here, one clerking and the outpatient, giving medicine, clerking also at the CCC. But when I always went to my room and see that card, I said, I have the responsibility.
I'll give you another one. It's a joke.
Thank you. So they came and you came and told us the HRO who really done a phenomenal job in our CCC. Because now I have a space to think and do my things, we sat down and actually find a way how can we bring back this, the defaulters, lost to call. We call the CHVs, those that are linked to the CCC. We told them what we wanted, that we have a lot of patients here, and a lot of patients also are died. And it is our responsibility to bring them back, because when they die, we have failed in our position. We discussed that with the CHV and the expert clients. That's where now the numbers started rising. In the issue of documentation, actually it was very poor. I myself, I did not make an appointment because I have never did it before in that appointment. It was actually like was it 1 year was never updated. Mine was to kill drugs and see if the patient is doing well or not. And the EMR, we call the program the Peter Lloyd, had oriented me on the EMR how to enter that, but that was only on the clinical side. Now when I was entering, I realized it had a lot of problems. We had double entries. We had some patients who are not having a CCC number, they are not in the system. So it also gave us challenge even to make a report. But with my help, he came and aligned everything. And I was happy with that. We saw that it was actually a big mess before he came. I really appreciate for that.